Following yesterday's release of the latest proposed healthcare reform on Capitol Hill, Wall Street analysts have begun to weigh in on the potential winners and losers. Bloomberg's Adam Johnson crunching the numbers and has them for us. Adam.
Yeah, hey, Chris. By the way, maybe we really should all move to Canada. But
right?
That's right. But
2 to 3
absent that,
times longer. Whew, imagine the weight on the healthcare system then.
I know. But absent that, we'll talk about healthcare here in the U.S. And according to the analysts, the apparent winners at this point, pharma and managed care companies, which may come as a surprise, the MCOs. Now, in terms of pharma, they will pay the smallest share of that $12 billion that's part of this bill, about 19%, $2.3 billion. Now, that sounds like a big number, but Chris, to put that in perspective, just Pfizer alone last year had cash flow of almost $17 billion, and the whole pharma industry will have to pay about $2.3. All right, moving on, the MCOs. According to Jason Garda of Lyric Swan, he says it's not great, but it could have been a lot worse. Number one, there's no public option that would compete against the MCOs. And when we say MCOs, we're talking Aetna, Humana, UNH, WellPoint, et cetera. And point number two, he said this co-op argument, which is a real key part of the plan, he said they're going to be a lot smaller than originally anticipated, which means they won't really have, in his words, the teeth to go after the margins of the MCOs. Now, moving on to the losers, hospitals and medical devices. Medical devices, well, actually, let me start with hospitals, because it's really pretty dramatic, Chris. They will effectively be less reimbursed to the tune of about $155 billion over 10 years. That's $15 billion a year. Their profit margins are only 2%, so this will really hurt them. And number two, medical devices. As J.P. Morgan's Mike Weinstein, as well as HealthPoint Capital's Lauren Uzdinsky said, this number, $4 billion, that's what they're going to have to be responsible for, is so far out of left field, they don't even know where it came from. They think ultimately it gets negotiated down. In terms of profit margins, the MCOs at 4.1%. Scott Feidel says it could have been worse, but it's just not fair. They're paying a lot in the hospitals. As we said, it's tough for them. So the losers and the winners.
Thank you so much, Adam. Looking at those profit margins, looking if they can actually afford it.
Yeah.